people in the medical industry are very tired because they're spending so much time documenting and making sure that codes are put in correctly. And that is not why we went to medical and pharmacy school.
What do you want to talk about?
I think what might be interesting is just understanding why we even started Zup. So why don't we start from the very beginning and talk about concierge medicine, direct primary care, and why the divergence from a traditional insurance-based medical model?
All good questions. One of the things that comes out immediately is, what is the difference between direct primary care and concierge medicine? They're remarkably similar.
Sure.
They're remarkably similar. Both of them are a membership-based system. People are very comfortable talking about concierge medicine because that's kind of a term that's being thrown around a lot, and they're less comfortable and less familiar with direct primary care. But in reality, both of them require that you join, and both of them involved either a monthly or an annual fee. Difference is that direct primary care traditionally offers an age-based fee, and concierge is just a flat fee. Mm-hmm. So that's the beginning of it right there. They're remarkably similar.
Yeah. I think some concierge practices will go ahead and take insurance, and some concierge practices won't. So there is a difference there. And direct primary care is absolutely unaffiliated with insurance-based payment forms.
Yeah. Direct primary care clinics are notoriously lean operations. And the way that they succeed is by eliminating the insurance model completely. And in doing so are able to work with reduced staff. Traditionally, there is a physician, there is a receptionist, medical assistant, and again, they operate fairly frugally. But they're also very successful in the quality of care that they provide. Concierge medical care or practices often and almost always operate in addition to insurance, so they add value.
Concierge benefits the patient as well as the provider, because typically a primary care physician in an office of 2,000 patients may say, look, I'm going to go concierge, I'm going to reduce my patient load to 400, definitely elevating their professional satisfaction. And they have more time then to care for the patients that they have, and that is the benefit to the patient as well. So, the word concierge implies frou-frou, if you will, but I think it's just an effort to improve care on both the patient and the providers.
It's a two-edged sword, isn't it? Because as providers, physicians, nurse practitioners, PAs, as they are agreeing to see these 400 or 600 patients in their clinic, as opposed to, as you pointed out, 2,000, up to 3,500, 5,000 patients sometimes. But as they're agreeing to see that, that means that they're also saying to the other 1,500, I can't see you. I'm sorry. I'm changing the model of my practice. I can no longer see you. So at the very time that we are increasingly short of primary care providers, the DPC and concierge models make us even shorter. That's the reality of it. There's fewer and fewer doctors going around to see a greater number of patients who are increasingly my age or older and require health care at a greater frequency. What has happened is twofold. One is that physicians and providers in general are very frustrated with the insurance model. It costs a tremendous amount of money, as you and I know, that in order to take insurance, you're talking about 1, 2, 3 billing individuals, a billing company that is going to charge somewhere between 5 and 8 or 9% of your revenues. And then it's the lack of predictability of what you're actually going to get paid by the insurance company.
Right. Not to mention that you may not get paid even up to 50% if you're not coding correctly.
Or not paid at all.
Or not paid at all.
Not
right.
paid at all.
Right.
Yeah.
And the reimbursement model has driven providers to really pull their hair out. People are very tired of, at least people in the medical industry are very tired because they're spending so much time documenting and making sure that codes are put in correctly. And that is not why we went to medical and pharmacy school. We went to help the patient and to spend more time with the patient.
Yeah. That's the insanity of it. But here's the problem with both direct primary care and concierge practice. The reality is this does not suffice for comprehensive protection in healthcare. If you and I walk outside and get hit by a bus, being a member of a direct primary care or DPC practice or concierge practice is not going to protect us when we need to be hospitalized,
Right.
operated on, rehabilitated, and supported.
Right.
That's where your catastrophic health insurance comes in.
Right.
So maybe in the perfect world, you have primary care that is provided. And I've heard you use this example before, that you don't use your automobile insurance for an oil change, right? You go in, you need to have your oil changed, you pay your money, it's $50, $60, $75, $100, whatever it is, and you move on because that's part of operating the car. And that primary care should be very similar to that. Think of it as an oil change or a tune-up. That's your primary care. However, if you get T-boned at an intersection, that's when your car insurance comes in. And likewise for catastrophic health events, your cancer diagnosis or broken hip or whatever it may be, your heart attack, that's where your catastrophic insurance should come in. And that would be as close to an ideal system that I could envision, where people are responsible for their general health care, but there is some form of protection if things go really bad.